Working with individuals with intellectual disabilities can be an extremely rewarding and fulfilling job. It's a job that requires patience and sensitivity because at times it can become tense, difficult, and frustrating. One must remember that individuals with intellectual disabilities have rights, emotions, and feelings like everyone else. At times, a person with an intellectual disability can appear to be acting in a contradictory manner. It's not easy to conceptualize what it is that a person with an intellectual disability knows. People with intellectual disabilities are sometimes thought to be unaware of what's going on. They may seem to understand something one moment and forget it in the next moment. Many people with intellectual disabilities have difficulty expressing themselves. It's harder for them to communicate their needs, so their behavior is often misunderstood. The difficulties in working with people with intellectual disabilities can make an ordinary situation tense and irritating to staff. A frustrated staff member might respond in an inappropriate or abusive manner. When staff respond inappropriately, it may be in the form of punishment, teasing, or humiliation. It can be very subtle, such as invading the individual's privacy or treating the individual as if they're not present. In the following 6 scenes, you will see examples where staff interacted inappropriately. Your instructor will stop the video after each scene for discussion.
And this is Teresa. She's been with us for 5 years now. She can be a real problem. She has self-abusive behaviors and she bites herself all the time.
She's not usually this much of a mess. She's just been doing this for about a month. Teresa, stop it.
What are you doing? No, bad girl, bad girl. Now we have to clean this up. No, you can't eat it.
I want coffee.
Not right now.
I want coffee.
Not right now. I'm helping her with her shoe.
She's no good. I want coffee.
Later. Not right now.
Now!
All right, that's enough. Somebody come help me with him. We're going somewhere where we can cool down.
Get on the bus, guys. We're in a hurry. Go. Come on, Kirsty. We gotta go.
Let's go, Kirsty.
Come on, Kirsty.
Come on, we're not messing around.
No, I'm not going to work today. Kirsty. Come on. No, you're getting on the bus, Kirsty.
No.
I hate work. I hate you. No.
Soda.
Hi, Darren. You want a pop, don't you, dummy?
Soda.
Darren, you're such a mooch.
No dummy.
Hi, Darren.
Hey, how are you?
I'm good. How are you doing, Roy?
Good. How's work?
Oh, pretty good. What are you working on today?
When you choose to work with individuals who have intellectual disabilities, you are taking on a special responsibility. These people are in your care, and you are here to help them learn. Even under pressure and frustrated, you are expected to interact appropriately at all times. When staff react with anger, this has no long-term benefit to a person with an intellectual disability. It may make them stop doing something right now, but it doesn't teach them what they should be doing instead. And so, inappropriate behavior is likely to be repeated.
Good afternoon, Teresa. How was your day at work today? Good. Darren, what is this?
That's mine.
Where did you get it?
Workshop.
It's not even caffeine-free or diet, and you got it from Workshop? Why did you bring it home?
Because
Are you
it's
supposed
mine.
to?
Yes.
I understand it's yours, but you're not supposed to have this. You know better. Go in there and get your lunchbox put away and think about what you brought home. Good afternoon, Teresa. How are you doing? Good. Hi, Darren. How was your day today?
Shut up.
Well, what's the matter, Darren? Did you want to talk about it, Darren?
You know, it's time to do programs right now.
No, Roy.
It's time to do your programs.
Watching
You
TV.
gotta do your programs. Come on, let's
No, watching TV.
No TV. It's time to do your programs.
No.
That's enough. I'm shutting the TV off.
Oh, no.
No TV. It's all right. Calm down.
Watching TV.
Settle down. It's
The
all
best
right.
way to avoid harm is for you to be properly trained. This training course will provide you with the skills you need to prevent many of these kinds of situations and safely handle those that you cannot prevent. It is not a replacement for specific behavior programs. It is a series of general procedures to use as a guide in dealing with aggressive or disruptive behavior if there is not an established program in place for that specific behavior for that individual. This program is based on the following goals: using the least restrictive interventions and using the least restrictive techniques necessary to manage the situation. The individuals that you will be working with have emotional lives like your very own. Sometimes they are happy, cheerful, in a good mood, and easy to get along with. At other times they are sad, angry, hurt, and difficult to get along with. Most individuals with intellectual disabilities have a hard time learning things. One of the hardest things for them to learn is how to show their emotions in a socially acceptable and appropriate manner. When an individual with an intellectual developmental disability is in a good mood, this difficulty of self-expression may show up as inappropriate laughing, being overly affectionate, or acting playful and silly. If they are in a bad mood, however, the difficulty they have in expressing their emotions properly can lead to some serious situations. Due to possibly limited language skills, they may not be able to tell anyone how they feel or what is bothering them. This language barrier may make it difficult for them to get the kind of care or attention they need. In addition, the inability to tell anyone about the problem can produce even more emotion by making the person feel frustrated or alone. Like all of us, an individual with an intellectual disability feels the need to express their emotions somehow, but he or she may not have learned socially acceptable ways to express their emotions. There is some danger that these emotions may be expressed as an aggressive or disruptive act. It is important to know the kinds of things that can cause people to become agitated or aggressive. If you can recognize that a person is becoming agitated or aggressive, you can deal with these situations before they worsen. Even when you cannot prevent such an incident, knowing the kinds of things that can lead to such situations can help you understand why the incident occurred and enable you to take steps to prevent future such incidents. There are 3 general causes for aggressive behavior: physical, psychological, and situational. Physical causes affect your bodily well-being. Psychological causes affect both your mental and emotional states. Situational causes are related to your immediate surroundings and environment. All 3 causes may determine an individual's reaction to any given situation. These causes produce emotional and sometimes inappropriate behavior in many people every day. Individuals with intellectual disabilities, however, face special problems that make these situations even more difficult. This is Mrs. Smith,
Mrs. Smith, I'm here to see Dr. Johnston.
who works at a development center for individuals with intellectual disabilities. Last night, while she was watching television,
How long's it going to be?
she bit into a piece of hard candy and got a sharp pain in her tooth. She is miserable, hungry. She is torn between the fear that having the dentist take care of her tooth will hurt
Heaven help me. Please get me some assistance now.
and her need to have her tooth pain stop, no matter what it takes.
Is there anybody listening?
She speaks to the receptionist about how long she is having to wait.
Never been treated like this before in my life.
She is mad and not very nice to her. Teresa lives at the facility where Mrs. Smith works. Teresa is also going to the dentist this morning, but she didn't make the appointment herself because she has almost no functional language skills. Like Mrs. Smith, Teresa felt a sudden pain in one of her teeth while she was eating. The pain has kept her from sleeping well, eating naturally, or drinking anything cold for 5 days. For the past 2 days, Teresa has been just walking around and slapping her face and jaw. Last night, her tooth developed an infection, which caused her jaw to swell.
Hi, this is Teresa, and she has an appointment with Dr. Johnson today. Thank you.
The staff took Teresa to a doctor, who referred her to a dentist.
I said try not to hit it.
Mrs. Smith and Teresa both reacted to the same type of pain in much the same way. They were hurt, angry, and frustrated. The important difference is that Mrs. Smith was able to understand the cause of her pain and seek help immediately. Teresa had to wait for someone else to recognize her problem and get her help. Physical discomfort is a very strong cause of aggressive and emotional behavior. Many individuals with intellectual disabilities have difficulty learning how to ask for help, or even realizing that such help is available. They only know that they are hurting and upset. Not all situations like these are caused by physical discomfort or pain. The second cause of aggressive behavior is psychological.
Oh no, what are you doing? This is wrong, all wrong. This is not what I said to do. You're gonna have to start over.
She should have told me the first time. She should have told me the first time. This is all wrong. All wrong. Got to do it again. Got to do it again. All wrong.
Can I have a brownie?
It's not time yet. Let's play the game.
Can I have a brownie?
It's not time yet, Norm.
But I want a brownie.
Let's finish this game first.
I want a brownie now.
You have to wait till snack time, Norm.
No, now. I want a brownie.
No, Norm, have a seat. You gotta wait.
No, I want a brownie.
Have a seat, Norm. You gotta
I
wait.
want a brownie.
You gotta wait, Norm.
I want a brownie.
No, Norm, you have to sit down.
I want a brownie now.
Norm?
I want a brownie.
Okay. Here you go, Darren.
Roy, did you get that incident documented last night?
No, I forgot all about it.
Damn it, Roy, I've told you 100 times. If you don't document it, it didn't happen. Next time, I promise, I won't forget to write you up if you forget to do your job. Now go back to your desk and do your job. You might want to start with the documentation.
Sometimes an individual cannot direct his aggressive feelings at the person he is angry with because that person is too big, too strong, or out of reach. In this case, the angry person may take out their feelings on someone who is smaller,
Darren, how many times have I told you to go clean your room?
weaker, or within reach.
Now get over there and go clean that pigsty of a room of yours. Right now.
This is known as displaced aggression and occurs most often with people who live together. Psychologists have found that an individual's normal emotional development progresses in stages. Some aggressive behaviors are a way of expressing a developing sense of identity and independence during the maturation process. You may be working with individuals who are still progressing through different stages in their emotional development. They may function at a level where anger and other aggressive behaviors are common. The ability to experience independence is just as important for the growth and development of individuals with intellectual disabilities as it is for a child's development.
Slow down, don't eat so fast. There's no race, and make sure you use your silverware.
The correct way to handle the aggressive behaviors that sometimes accompany this stage is to try to channel their energy away from harmful aggression toward appropriate assertive behaviors, such as with competitive games or sports activities. The third cause of aggressive behavior may stem from irritation at environmental factors, such as noise level, temperature, other people's moods, or overcrowding. Everyone prefers to keep a certain comfortable distance between themselves and others. our personal space. When our personal space is invaded by others whom we do not know well, we may feel threatened and behave defensively. Individuals with intellectual disabilities have the same needs as we do for privacy and personal space, even if they are not able to articulate those needs. If you put people in contact with one another without taking into account their individual needs for personal space or the difficult personalities involved, you are setting them up for possible conflicts. Remember that as staff, you are part of the environment. How you look, act, and react on the job can make aggressive behavior more or less likely to occur.
Shit.
Individuals will imitate your behavior.
Shit!
Darren, don't talk like that.
Shit!
This part of the training program will help you prevent aggressive behavior from occurring. Keeping careful records, informing professional and other staff, and following individual programs are the basic steps you can follow for day-to-day aggressive behavior.
Settle down, it's all right.
First, you must be a careful observer. Notice agitation and work to prevent situations from becoming aggressive incidents. When an incident does occur, try to identify the likely cause and take action immediately to eliminate that cause in the future. No matter what you may have done to eliminate the causes, there will be times when individuals become upset, agitated, or angry. When this happens, there is always a possibility that they may act out aggressively. Part of your job is to help them learn acceptable ways of behaving. If you're faced with an agitated person, it will be up to you to help calm them and keep the situation under control. Knowing how to handle these situations correctly can help you diffuse many confrontations.
You're doing them all wrong.
What's the matter?
I can't do my job. She's doing them all wrong.
Well, let's calm down. Let's do one at a time.
Diffusing these sorts of situations need not be difficult if you know what to do and how to do it.
I'm afraid I have some bad news, guys. The maintenance guy just called and the van's still in the shop. We don't have a van to take us to bingo tonight. I know. I'm sorry. Sometimes these things happen, though. I'll tell you what, instead of going to bingo, we'll bring bingo to us tonight. We'll have it here instead.
But who's getting a soda?
Well, we have soda, Kiersey. We can still have soda. I'll even make some snacks for you guys. And prizes. We'll have prizes just like we do at bingo. It'll be just like at the bingo hall. We'll just do it here instead. Okay, does that sound like a plan? All right, I know you guys were all ready to leave, so let's put our stuff back and get ready for bingo here. I need you guys to be ready in about 20 minutes, okay?
In this scene, the staff managed the situation correctly.
What's the matter, Darren?
That sucks. My girlfriend's supposed to meet us at the bingo hall.
At the first sign of agitation, go directly to the agitated person and speak with them. Don't be dramatic. You don't want to embarrass them or draw undue attention to them.
Oh, well, let's sit down and talk about this. You want to sit down? Why are you so upset, Darren?
Relax and try to compose yourself so that you appear calm and in control. If you appear angry or out of control, you may increase the agitated individual's emotional response. By appearing calm but concerned, you communicate that you are there to help them, not threaten them. Speak slowly and clearly in a quiet and soothing tone.
Well, we know Jenny has plans tonight, but maybe she doesn't tomorrow night. We can have her over for dinner. Would you like that?
Lower the volume and pitch of your voice. Even if the individual doesn't appear to understand what you're saying, your relaxed, calm stance, soothing voice, and show of concern will communicate to them that you are not a threat. You need to appear as supportive as possible if you believe that the problem is something that you are confident you can solve quickly. Concentrate on communicating your concern to the individual and make sure they can see that you are trying to help them. Try to get on eye level with them. If they are standing, try to get them to sit down with you to talk. Make sure you sit down and stand back up at the same time as them. This is important because if you sit or stand up before them, they may mistake your intent and become more angry and aggressive. If the individual does not want to sit with you, remain standing and continue speaking in a calm, quiet voice. Let them know that you intend to resolve the situation and you are not going to leave them. The longer you can remain with the individual, the greater the chance that they will calm down and the situation will end without incident. Stay with them until they become occupied with another activity. Finally, continue to monitor the situation from a distance and make sure to document the incident. There will be times when the individual you are dealing with may already be extremely agitated by the time you intervene. These situations can also be handled successfully, but require a different approach. It is extremely important that you give yourself some extra time right from the start to prepare for handling the situation. First, compose yourself and relax. Next, choose your approach carefully. Position yourself in front and to one side of the agitated person. For your own safety, stand just beyond the reach of their arms. You should speak in a calm voice, lower the pitch and volume. It is best to try to show no reaction at all. If you try to appear friendly, they may misinterpret this and think you are laughing at them. A concerned or worried look may be interpreted as fear, and they may try to take advantage of you. Try to stay relaxed and emotionally neutral. Do not argue with the individual. Do not make any demands of them. Do not disagree with them. This is not the time to try and sort out what happened or try to get them to see the other side of the situation. Remember, if the individual is very upset and is not in control of their emotions, it will help if you let yourself and your muscles completely relax. Staying relaxed helps you stay safe. Tense muscles will work against you, and evasive movements will not be as effective. Relaxed muscles will be ready to move for you if you need to move quickly out of the way. Keep your mind on what you're doing. Take deep breaths if needed. Keep your voice low and your body and face relaxed. Stand in the correct position. Make sure the person has a way to escape. Once the individual has calmed down, follow the same procedure that you would with someone who was agitated. Never punish the individual for becoming agitated. Make sure they are involved in an appropriate activity before you leave. Keep an eye on them from a distance until you are sure that it is safe to leave. Remember to document and report the incident. Following the correct techniques step by step will help you feel more confident. If there is a specific program in place for a certain behavior for that individual, always use that program. A set of instructions for an individual's specific behavior pattern will be more effective than general techniques. If you follow proper procedures and use correct techniques, you should be able to keep those situations under control without the use of force or physical supports. Most importantly, you will be able to avoid a confrontation and maintain the safety of individuals and staff alike.